All right, welcome in everybody. Plan today for eCW University is to go over the treatment screen and just how to do the treatment screen and some different best practices and any suggestions that some folks might have um, on how to use the treatment screen. So treatment screen obviously is right here. Scrolling down in the note, you click on treatment is one way to get to it. Um, I still like the idea of navigating the note through. I just like to put details or any blue hyperlink. So if you're up here in HPI and you want to jump down to treatment, you can click on any of the blue hyperlinks, and then you have these navigation fields right here to take you right to the treatment screen. Diagnosis is DX, and the treatment is the little RX here. So that's probably the best way to navigate the note to get to the treatment screen the fastest. Um, the other way I like to, instead of scrolling through the note, if you're not a mouse user, then it's tough to scroll through the note unless you have a trackpad that allows you to scroll with two fingers. If you don't, then you end up going to this little arrow and clicking multiple times very fast in order to scroll through the note, which is really annoying. So just a couple different ways, just navigation-wise, you can click on, I just like to go to details, and that opens up your chart basically, and then you can go right to treatment from there. Um, So from here, you'll have your assessments in, hopefully. And again, these things go by whichever folder appears to be open. So you can see kind of the foremost appearing folder. Not totally jumps out off the screen at you, but you can kind of see whichever diagnosis you're working on, the treatment plan for each diagnosis changes. So you want to go to your first diagnosis, and you have a myriad of different things you can put in here. So we'll just kind of go through top to bottom, left to right. Um, Current RX, and then so this is how to add a prescription for a patient. So you can click on current RX, and it'll open the patient's already verified list of medications, and you can use any one of these buttons right here: continue, refill, 30, 90, or stop, based on the diagnosis. So from here, you can have default set up right here. So when I do a 30-day supply, I have mine set up to do 5 refills. When I do a 90-day supply, I have mine set up to do 3 refills. So 90 days with 3 additional refills is a whole year's worth of medication. Usually on a 30-day script, I'll only do 5, just kind of my own prescribing habits. You can do whatever floats your boat for your prescribing styles, but that's something you can leave as a default, um, which is kind of a nice feature because now whenever I hit the 30 or the 90, you can see it'll automatically put in 5 refills. If I hit the 90, it'll automatically put in 3 refills. So that's a nice click saving thing to have in place for you. So this defaults to showing your medications by date, which is great. And so if they were verified today, then you'll see all the ones that were verified today. And they also have the not taking ones on there, and that's a new change with this version, but that's okay. But you can kind of see, just make sure you're looking at whatever the action that was put in for the medication. So if it shows them as taking versus start versus not taking. So when you add a medication, then it defaults to start, obviously. Um, so from here, I think those 30 and 50 are really nice. You can show up to 50, up to 100, up to 200. Hopefully you don't have patients on that many medications. But from there, it usually defaults 50. I haven't seen too many patients past 50. If you have, let me know. You deserve an award for caring for that patient. So from here, couple different things. Now you can actually search for medications. So one thing that's not a lot of people know is you can actually change this to search by medication name instead of date. You can just change that drop down. And now, and then when I click all, I can see actually all the medications the patient's ever been on before, and they're not necessarily verified as of taking them today. So if they say, you're digging through their blood pressure history, and they were previously taking a blood pressure medicine that they had stopped, and that's not on their current medication list, I can change my list here to all, and hit this drop down and go back here and find it and then refill it from there just as it was prescribed before. And you can see it here. It pulls it up now by date. So this is as it was prescribed on the 30th. This was as prescribed on the 29th of July, on the 9th of June, 6th of June, 29th of April, and so on and so forth. And so you can refill it just as it was prescribed in the past, and even though it's not on their current medication list. So that's a nice feature. Going back to date, which is how most of yours will default to. You can also search. So you're like, I swear I had this patient on amlodipine in the past or whatever it is. You can do a search here, and I don't think this patient's ever been on amlodipine, but this test patient. But if I look right here and I kind of take a look at what they're on currently as of today, I change this to medication, and I leave this on all. Looks like she has been on amlodipine in the past, and now when I search this, when I searched it before, I was only searching my current list, but see now I can search any medicine. So if I search amlodipine, then it pulls up the amlodipine, and I don't have to hit the drop-down number to scroll. So if you kind of remember that, I thought I had started you on something in the past, and it's not on their current list, you can go to medication and change it to search. That way, the other thing you can also do is, you can look for them just on your list here.
So I had a question.
Yeah.
What, when you're refilling prescriptions, if you can go ahead and click on one of his medications and bring up the blue circles.
Sure. Let's go back to date here.
What's the difference between continue, refill, or refill the days? How does that put the medication in differently as far as the assessment and treatment screen?
Great question. So if I go to, for example, I'll go to abdominal pain. You have to make sure you're on the right diagnosis. And when I pick my diagnosis, I'm going to refill omeprazole. So I can do continue, which won't fill in my DDR, dispense, duration, dispense, and refill. I can just hit continue, which is fine. But if I want to I can hit refill, which again, it'll put in just as it's been prescribed in the past, which it may have the DDR on it, the duration, dispense, and refill. You can see right now it doesn't have the duration, which is not necessary to e-prescribe, but dispense and refill is necessary to e-prescribe. So if I just hit refill here, that probably suffices. So let's go ahead and look at that, how that played out. So it put it in just as you saw it as it was verified today. So it puts in omeprazole twice a day, number 60 with 3 refills. Totally fine. Right, if that's how you want to prescribe it. Now let's go back and let's say I go into my current medication list. I'm on abdominal pain. Let's say I want to change that to a 90-day script. I can go to omeprazole, and instead of hitting just the refill or the 30, I can now hit 90. And it should change it to now put in a 90-day duration. Popped up my interactions there. So just put it in as 90 days, and sometimes it triggers the calculator to where it does the math for you. And this time it didn't, probably because it hasn't been put in this way before, so a 90-day supply would be 180. You have to put in the type 180 tablet, click OK, and now you're off to the races for a 90-day supply with 3 refills. Because I believe it had it in there before, it didn't do the calculation for you. Yeah, you had a question? Yeah, let me try that again. So if it's, let's try a different medicine. So for example, lisinopril, you'll notice there's no duration, dispense, or refill on there. So if I go to, let's say this is, if I go to previous diagnosis, I should be able to access the patient's problem list or previous assessments that have been put in here. I would imagine hypertension's in here somewhere. There it is. So even though it's an ICD-9, we'll go with it. So now I've got my, I've added hypertension, and you can actually get the 9 to 10 mapping here, which is kind of nice. So now instead of using the 9, it gave me a 10. I'm going to click on my hypertension. We'll go to lisinopril. Now if I hit a 90, because these are blank, it should give me a 90-90 with Again, my default 3 refills. Believe I hit the right button. Let's just make sure. Ascendant Pro, so I can just hit my 90. So if I close that out now, I go to my hypertension, make sure there's no interactions. See it put in the 90. This is a test patient, and none of the fields have been filled in. Usually, when you're keeping clean med lists, all this stuff's obviously filled in, and it does the math for you. I think this just being the test patient, but if you play around with that and you hit just the 90, it should put in 90 days, and it should put in 90 because it's Q day or daily medication. It should put in a 90 for you there. But obviously, I'm going to fill this all in. So anyway, daily, once it see that, the daily wasn't put in. Once the daily's in there, now it did the math for me. I don't know if you saw that. It was blank. So you actually have to have the SIG filled in, and then those buttons work. So if I open that again, and if I change this to daily, see it did the math for me and put in 90 tablets because I used my default. So that's one way to do it. So then, yeah, when your med lists are fully filled out, then these 90 and 30 buttons work, and they're pretty slick. Does that make sense? Was that mostly your question?
Yeah, just kind of how it ended up on. Yeah, that totally.
Yeah. Yeah, excellent. And then obviously the stop button is a stop button. So if I don't want her to take the medicine anymore, I'll just click stop, and then it throws it under the diagnosis email and stops it. So if I'm not necessarily addressing the problem that day, sometimes I'll just go to other and stop a bunch of the medicines on their list that they haven't been taking for several visits now, and nobody's taken off. And then it kind of cleans it up. So you have continue, refill, 30, 90, stop. The continue is just kind of something I will throw on if they don't need any refills and they're pretty stable. So when their diabetes is at goal, I'm not making any medication changes, so I'll just kind of go to their diabetes diagnosis and hit continue on all of their diabetes medicines.
Right. Just continuity of care.
Exactly. And that really helps our refill protocols, our refill nurse practitioner, Susie, and that really helps to kind of show that you've addressed this problem and you want them to continue those medications, and then she's more apt to refill the medication for you when you've addressed that you've actually shown you want them to continue the medication. It is fairly tempting to not put continue on each medication by diagnosis. It's a little cleaner of a note and a better communication to all of us when we address each medication in the visit. But I'll kind of leave that up to you. So that's basically how kind of that medication piece works. And then when you put in a medication, if you decide you don't like it before you prescribe it, you can click remove right here, and it takes it off. Another important piece is make sure in order to access favorite prescriptions, you're hitting RX without formulary. We still don't have a default to make it that be the default RX button if you just hit add RX. So still just remember to hit the one drop down and then hit add without formulary. It's an extra click, but then it gets you to the screen where you can access favorite prescriptions. Hopefully everybody is adding and using and building favorite prescriptions. Again, yeah, amlodipine, we talked about that for this patient. If I wanted to just prescribe it newly off of my favorite list. And again, the nice thing about favorite meds is I've got all my SIGs filled in here, so I got a bunch of different ways to prescribe amlodipine 5s or 10s. I can do a 30-day with 11. I can do 90-day with 3. I can do a 30-day with 5 or a 30-day with 11. You can build different ways you like to prescribe it, and depending on the patient and their background and all that good stuff, you would adjust that. So that is kind of medication order entry in a nutshell. Any questions on that? Again, no, not the most intuitive way. So you actually have to, when you go to add the medication, pick a diagnosis here. Let's add a medication. Let's see, how about ranitidine? I'm going to go to my favorites. choose my ranitidine, put it in. So now I've added it. Um, the way to modify it now is you have to actually come out of that screen and go to your prescription. And if you've added off of a favorite, then it's usually dialed up as you like it. But if you want it to modify it, then you have to go to the screen and click on and open it. Or you can also take the pop-up button off. There's a pop-up button right here, and you can modify within each cell this way, which is kind of a nice feature. So yeah, that's some if some people are pop-up people or some people aren't. I'm a pop-up person just because you can easily make it a favorite prescription right there. Once I've done the pop-up, I've modified it as I like it. And when I make a variation of a medication I prescribe frequently, I will make it a favorite. Because then when you hit the favorite and you search for them, then you've got all those variations available. So again, add as favorite right there, and you can do that. One also time saver is if you don't like what you see here, there's this clear DDR screen which erases your dispense duration and refill, so you can set it up newly. So yeah, and again, once I have my twice a day in there, my calculator works. I hit 30 days, and it automatically throws in 60, and then I can pick my refills. And hopefully everybody has these default options. These are customized things that I've built into there that you would have to you have to have your settings set up to where you can see customized dosages. I may take a briefly just to make sure everybody has that. A lot of the medical assistants aren't set up that way, and we should probably work to get everybody set up to do that. If you're not, let me know if you don't have those drop-down options, because otherwise it's really annoying to have to hit the drop-down boxes and type in 30 instead of just hit a box that says 30 days. So back to my treatment screen. Again, by diagnosis. So that's kind of medication order entry. I think that may be all we have time for today, but certainly a valuable topic that will hopefully save some time as far as continuing, stopping, and refilling medications. Any questions out there before we wrap up this brief training?
No, I'm good, thanks.
Okay. All right, everybody. We're going to leave it at that. There's probably a whole bunch more to do with medication, with our treatment screen. We mostly got through medication order entry, which is an important screen. Other stuff to think about, it would be eClinisense, play around with it. And then lab order entry, there's some tips and tricks. We've already done a training on that in the past, but hopefully that helps you with medication order entry. Thanks, everyone.